In India, a nationwide lockdown for the first time happened on March 25th for 21 days. By this time, there were only 519 cases and 9 deaths reported. Almost a year later, in March 2021, the cases climbed up to 4 lakhs and averaged about 4,000 deaths per day, and yet no nationwide lockdown has been imposed. The reason? Yes, you are right. It's because of the economy. India could not survive another major blow on the economy after the first phase of the pandemic. People lose jobs, migrant workers are displaced, and production for national and international markets halt, and it impedes the economy severely. And the world countries will be directly impacted, with India being the 5th largest economy in the world with a 1.4 billion population. India has always contributed to the world's economic growth. Having a high population and growth rate, any adverse changes in India's economy will have a subsequent effect on the world economy as well. The Republic of India shipped $322.8 billion worth of goods around the globe in 2019. This is what India's exports are worth in the world economy. India is the largest producer. 13.7% of total exports of world's mineral fuels and oils come from India. India exports 11.4% of the world's gems and precious stones to various parts of the world. 6.6% of the machinery and 5.7% of organic chemicals of the world come from India. The Indian pharmaceutical sector has 16.1 billion USD contribution to the world's economy, and lastly, India produces 3% of the world's iron and steel. So, due to this pandemic situation in India, will eventually affect the growth of the income in other countries directly. Ultimately, this will lead to a global economic crisis. COVID-19 has not only hampered the growth of India in 2020, but has affected the world's economy drastically as well. The second wave of COVID has taken many lives. The rate of deaths and infections is increasing rapidly, and daily cases are seeing a constant growth. Hospitals are crowded and there are no sufficient beds for patients. The shortage of oxygen cylinders and medicines is affecting people's survival rate. The Indian government has started on Oxygen Express with trains carrying the oxygen cylinders to places where the demand is high. The Air Force is also airlifting the oxygen from military bases. The Indian government has started turning the train carriages into isolation wards for the COVID patients. Sports halls, stadiums, and ashrams have also been converted into treatment centers to reduce the crowd in the hospitals and meet excess demand. Due to a high death rate, the funeral grounds are being overcrowded and there is a huge line for the same. Just imagine the condition of the country. They have been forced to turn to makeshift facilities for cremations. It was a terrifying and painful situation to witness during the pandemic. Despite the help from countries US, UK, Australia, Germany, France and others, India's pandemic situation is harrowing, not just for India, but for world countries too. Currently, only 2% of the population in India is fully vaccinated, and less than 10% of the population has gotten at least one dose. Vaccine shortages have been reported across the country. The UK had said that there is not a sufficient amount of vaccine to send, but will support India in other ways to meet the situation. India has already allowed the import of foreign-made vaccines, but none of the vaccine makers have applied for the emergency usage license in India. The United States says that it has identified about 60 million doses of AstraZeneca vaccine, which could be shared with other countries when they become available. But there is no confirmed information on how much of it will be provided for India. India's biggest vaccine maker, the Serum Institute of India, which produces Covishield, complained of shortages of specialized materials from the US. The production of the vaccine is reduced due to the shortage of raw materials. The vaccine suppliers are trying their best to produce more vaccines to meet the situation and hopefully will complete the total vaccination for the 45 plus age group in the next 10 to 12 months. Most Indian states are under lockdown for reducing the spread of this disease. The contagious disease has already spread through the passengers who traveled from India to other countries. If you look at the data, the tourism sector could hit it back by $1 trillion. Tourism generated $194 billion or 6.8% of India's GDP in 2019. and supported 39.8 million jobs, which are 8% of its total employment. The sector is predicted to grow at an annual rate of 6.9% to $460 billion by 2028, which is 9.9% of GDP. If we consider India's contribution to the world's economy through the tourism sector, the World Travel and Tourism Council calculated that tourism generated 16.91 lakh crores or 9.2% of India's GDP in 2018 and supported 42.673 million jobs, 8.1% of its total employment. To prevent the spread, India requires travel restrictions and also strict quarantines. This is a huge blow to the travel and tourism sector. This will have a large effect on global economic growth. This has highly affected businesses that have incurred tremendous losses during this pandemic. India is also one of the leading exporters of medicines across the world. The pharmaceutical industry in India was valued at $33 billion. This accounts for 20% of global exports in terms of volume, making the country the largest provider of generic medicines globally. India has the third largest pharmaceutical industry in the world. It exports drugs and medicines globally. Even during a pandemic, India is one of the largest producers of vaccinations. This clearly indicates that a crisis in India will automatically affect the export of all medicinal vaccines to other countries. According to the present situation, the pharmaceutical industry is playing a vital role in combating the never-ending battle of COVID, and hence it is evident India, being one of the biggest players in the supply of vaccines, the shortage of the same will affect other nations as well. India's share in global service exports is 3.54. The onset of COVID-19 outbreak that led to the global trade slowdown affected Indian exports substantially and led to a drop in Indian exports by 35% in March, 60% in April, and 36.5% in May of 2020. Outlining 10 areas where the action is required to boost exports, the Chamber said an open and facilitative import environment is required to attract global companies and ensure competitive access to intermediate goods. As more and more countries are looking at realigning their trading strategies and diversifying their import sources post-COVID-19 outbreak, India must leverage the present situation to emerge as an alternative destination for sourcing cost-effective quality products. The rupee is continuously depreciating. MSMEs will undergo a severe cash crunch. India must rethink her development paradigm and make it more inclusive. Coronavirus fears have sent shock waves across global financial markets. Indian capital markets are envisaging funds flow to Western capital markets owing to rate cuts and fall in the stock markets the world over. The crisis emerging from the coronavirus spread will pull down investment and consumption demand. Conventionally, the demand side components of GDP account for 72.1% consumption, out of which government consumption is barely 11.9%. The pandemic situation, which is affecting India severely, will automatically affect the trade links and services that are provided. This will lead to economic loss in various countries. As we are all aware of the present drastic condition, we need to be more careful and cautious about our health. We need to protect ourselves from this pandemic situation by maintaining social distance, wearing masks, and using sanitizer quite often. Let us all fight with this pandemic situation and hope to get back to our normal and peaceful lives again.